Just waiting for the audio and video. Confirmation, then we'll start. Okay, so we just got the confirmation. Okay, so good evening. So how was the paper? I'll just ask about the orthodontic section in particular. Anything you found difficult, out of course, or something which was not taught to you in your class? Okay, which was not there in your notes, any single point? Okay, so you can very well write in the comment section any such question was there, any point was there which was not part of your class notes. So as I've told you, the basic aim behind today's discussion is not to find out the correct answer or just get your scores corrected. The basic aim behind is to understand the type of questions which happened in your exam, okay, and whether you were able to answer. If you were able to answer it very well, if you were not, then it's the time to analyze your strategy, revise it, the concept, because in a few days times, approximately I can say 25 days time, you have your INI-CET May exam. I expect and I hope every one of you have filled their forms and are giving that exam. Okay, so once again, good evening everyone. So we'll start with the discussion of the question. These questions were based on the recall which I got and the options which I got from the student. If there is any discrepancy, anything which you would like to highlight or point out, just write in the comment section and I'll rectify it right here. Okay, so beginning with the first question. So what is the object to source distance in lateral cephalogram? So there were two versions of the question which I got. One said object to source distance or from distance of the X-ray or the source or tube to the mid-sagittal plane. Both technically means the same only. The options were 5, 6, 7, 8 or 4. They were, of course, you would have got 4 options only. I got the 5 options from the recall from various students, so I mentioned them as such. Okay, so this is a very simple and easy and direct question, nothing much to explain in it. So the correct answer was 5 feet or 60 inches or 152.4 centimeter. Okay, and that is the distance from the X-ray source to the object. Okay, and from object to the film, it is 15 centimeter according to Jacobson, or 18 centimeter or 7 inches according to Broadbent. Okay, so the total distance from film to source is 5.5 feet or 5 feet 6 inches. Okay, so rest of the factors, that is the magnification factor is 5 to 7% in a lateral cephalogram. Cassette is generally kept on the lateral left side of the face. Okay, and the KVP and MPa values are as such. Okay, moving ahead. So just confirm me with this question, the language is correct or not. So according to Tanaka-Johnston analysis, what should be the ideal width of the unerupted mandibular canines and premolars if the sum of the mandibular incisors is 19.5 mm? So this was a direct question from the Tanaka-Johnston analysis. Okay, and the value which I got was 19.5. Okay, and they wish in the exam to know about the width of the unerupted canines and premolars. Okay, so for mandibular incisors, for mandibular, the formula is 1/2 of the mesodistal width of the 4 lower incisors plus 10.5 mm or 11 mm for the maxillary canines and premolars. So 19.5 divided by 2 gives you 9s are 18, 9.75 plus adding 10.5. Okay, will give you the correct answer as 19.5. So 21.25 mm approximately. Okay, so hence this is the correct answer if the values as such are correct. Simple mathematical formula is there. Moving ahead towards the next question. Expansion of maxillary skeletal base after growth completion. I do not have its fourth option. The three options which I got were NITA expander, quad helix, mini implant assisted rapid palatal expansion. Okay, if anyone has it the fourth option, just write in the comment section and I'll add it to it. So if anyone has the correct fourth option of this, I can write it down. So someone said it's coffin spring. Okay, so that simplifies our task even all the more. Okay, so expansion of maxillary skeletal base after growth completion. Now the term is growth has been completed, means the transverse or the mid palatal suture has ossified, has fused. Okay, so none of these appliances, that is the NITA expander, quad helix or coffin spring, will work because they all work on the principle of unossified transverse suture to bring about slow maxillary expansion. So the best or the correct answer here would be mini plant assisted rapid palatal expansion. Okay, the correct answer would be mini implant assisted rapid palatal expansion. Okay, so in the beginning only I told you our aim right now is not to just judge the correct answer but to prepare you for your next exam as well. So further emphasizing or further moving ahead in this question, have you got another fourth option as surgical, or you can say SARPE or SARME, anything, SARPE or SARME, surgically assisted rapid palatal expansion. So in the next exam you might get, instead of they giving you the full form as mini implant assisted rapid palatal expansion, they can give you the option as SARPE or SARME. They stand for surgically assisted rapid palatal expansion. So that would be the correct answer. So do not get confused. If you don't want to find the term mini implant or something like that, they can provide you with a short form as well. Okay, so I hope I am clear. I'll move ahead towards the next question. Next question. Procedure done to remove the etiology of malocclusion, or another form of the question which they said was which of these treatment removes the cause of malocclusion. Now there was some kind of controversy related between two options. I'll just clear it right here and now with explanation. Okay. So looking at the four options, the four options are supracrystal fibrotomy, frenectomy, autotransplantation and corticotomy. Now the question is asking about done to remove the etiology of malocclusion. Etiology means cause, कि what is the cause या कारण क्या है उस malocclusion के होने का. Okay, it's not asking about ways to prevent relapse. It is asking about the cause of malocclusion. Okay, so looking at the fourth options, I'll start from the fourth option, corticotomy. Now corticotomy Answer is supracrustal. I'll move ahead. I'll just tell you the reason. Corticotomy. Corticotomy is a method of accelerated orthodontics. Okay, there is no need to have a kind of a discussion here. I'll help you with my explanation why I'm telling you the answer. Okay, the correct answer will be evaluated as per the key or provided by they have with the NBE. Okay, as I told you, my aim is right now not to point or put blames at anyone, what is there, what is not there. My aim right now is to prepare you for your next INI exam. कि अगर यही क्वेश्चन फिर से आ जाए so it will create a problem. Okay, thank you, Florence. You answered phenectomy. I marked it. Very nice to know. The phenectomy, according to me, is the correct answer. Okay, so corticotomy is a way of accelerated orthodontics. Autotransplantation is simply transplantation of an extracted teeth from one side to another. Okay, it's just transfer of teeth. So reasons you very well know, we are not here to discuss autotransplantation. Now the question or the doubt which was created was between these two options, that is supracrustal fibrotomy and phenectomy, and many students or some people also said that supracrustal fibrotomy is the correct. So supracrustal fibrotomy is never the etiology or cause of malocclusion. Okay, why supracrustal fibrotomy is done is to prevent relapse of rotation. कभी भी पेरियोडोंटल फाइबर्स के अरेंजमेंट से रोटेशन नहीं होता है. When we derotate the teeth, these fibers get entangled, or you can say they are not able to position or prevent the derotation of the teeth. So in order to prevent that rotation relapse, we do supracrustal fibrotomy given by Edwards, also known as Edwards procedure. So supracrustal fibrotomy is done to prevent the relapse of rotation. Whereas phenectomy, presence of a high frenum is always responsible for presence of a midline diastema. Okay, so even if you close the high frenum causes the presence of midline diastema, whereas supracrustal fibrotomy is a procedure to prevent the relapse of rotation. Arrangement of fibers is never the etiology of rotation, whereas presence of high frenum is the etiology of midline diastema. Okay, I hope I am clear and there is no confusion between these two options. Supracrustal fibrotomy is a procedure which is done to prevent the relapse of rotation, whereas phenectomy is done to remove the etiology or cause of diastema. And true, both are done. Phenectomy is also done once we close the gap. Okay, once we close the diastema, then the frenum is removed. Now there are various theories and various schools of thought. Okay, some say that frenum should be removed before closing the gap. Some say after the gap is closed and before removing the brackets. And some say the frenum can be closed, frenum can be removed once we have done with the treatment and the patient is on retention. Okay, there are various three schools of thought. Everyone, if you look at the orthodontic literature, everything has its pros and cons. Okay, but high frenum is responsible for midline diastema, not the arrangement of periodontal fibers. Okay, I hope I am clear with this question. Next controversial question which created trouble with certain group of people and the students especially whom I taught in my class, and highlighted why this group 1 and group 2 and why this criteria was changed. So today I am going to talk with reference. Okay, and you can take this reference and you can yourself check this reference very well in the books, and I am going to mention the reference along with the page number as well today, and not from just one book or from two books. Okay, so group 1, there were two types of question way which was found. I don't know which one is correct or not. Group 1 comes under Orin Ackerman Prophet classification. First criteria is the options of profile, alignment, class, type. Okay, class type सबको clear था. The confusion which occurred was profile and between alignment. So students, I very well mentioned in my class earlier, the criteria was first alignment. Okay, Vicky Chaudhary says 29 point. Okay, sorry, मेरी mathematics में वहाँ थोड़ी सी गड़बड़ हुई. In that question, I take back my this. Okay, option. The correct answer would be 20.25. Okay, thank you, Vicky, for your pointing it out. I hope the concept was clear there. Okay, so moving ahead towards this question. Thank you for that. I accept my mistake there. Okay, so moving ahead towards this question. So earlier, as I was telling, in earlier, we can say in the 19th century, the criteria was aligning teeth and not considering the soft tissues at all. Okay, later on, as the orthodontic science evolved, in this time we consider soft tissue profile as the first standard before diagnosing a place. We do not rely on cephalometric parameters or proclination for highlighting or for diagnosing or planning a treatment plan. Okay, and this okay. Okay, Florence, we can move ahead to the next question. It was just simple mathematics. I I hope everyone would have calculated it right in during our exam. I just calculated right now and I committed a mistake in decimals. Okay, the criteria was not testing your mathematics. The criteria was to test the concept. Okay, so coming to this question. So as I was telling कि प्रोफाइल फर्स्ट आता है, अलाइनमेंट नहीं. ये आई एम नॉट सेइंग these two standard textbooks are same. Okay, and the references I have mentioned here with page number and edition. You can very well check it, verify it with these three books. Okay, first is a very standard book of Orthodontics by William Prophet, 6th edition, which is the latest edition released in 2019. The page number is 196. And next, if any of you will pursue your orthodontic post graduation in orthodontics, will very well be able to study this book Kraber Vanistar. उसके पेज नंबर 226 से 230 में everything it's clearly mentioned that soft tissue profile is the first criteria which is now considered for diagnosing the place. Furthermore, to elaborate my point, I have clicked a snapshot and pasted in my this presentation as well here today. Okay, and taking this much deal and amount of time on this one question because there was few students who got confused by the answer, by the certain kind of answer keys which were released by some people. Okay, see, NB में जो पेपर बनाते हैं, they have to submit a solution जिसका एक रेफरेंस हो. अपने मन से आंसर कोई नहीं दे सकता कि उसका आंसर ये है क्योंकि उनको लगता है. They have to submit with each solution, they have to give a cross reference as well. Okay, so this is the snapshot as well on what is written in the text, which you can clearly see here. Furthermore, this is a Venn diagram which is present, which I took from textbook of Prophet, in which it's clearly said that first dentofacial appearance, जिसमें profile, lip position, incisor, display सब आता है. So first group criteria is dentofacial appearance. This is the image from Prophet only, which I have taken. I haven't taken it from here and there or just googled it. You can very well verify it from the standard textbook as well. Okay, so I hope I am rested this query or these doubts related to group 1 of Ackermann Prophet classification. Okay, next question. Now this time there were two questions from Ackermann Prophet classification. In Prophet and Ackermann classification of malocclusion, the circles 1, 2 and 3 represents which of these? Okay, a very easy question. We just saw the previous diagram. This is transverse, sagittal and vertical. So transverse, sagittal and vertical. Okay, so here circles 1, 2, and 3 represent this. The correct answer is option A, transverse, sagittal, and vertical. Okay, I hope I'm clear until now. So I'll move ahead towards the next question. If anyone has any doubt related to Ackermann profit, you can very well write. Or is there still confusion regarding the answer? उसमें ये लिखा था and all that. What I am talking is based on reference and not on what I have, मेरे मूड में क्या है या मेरे मन में क्या है, कि उसके अकॉर्डिंग प्रोफाइल फर्स्ट होना चाहिए. Okay, so this is the latest updated Ackermann profit classification, which is given in Profit Deber Van Style every standard textbook which is released post 2019. Okay, so which stage of CMI is shown in the image? I have deliberately not picked up any kind of image here because there was a lot of controversy. Each student was saying different, providing me with different kind of an image. Some said सर थोड़ी सी कॉन्केविटी थी C3 के नीचे, some said बहुत ज़्यादा थी सर accentuated, some said flat थी सर. Okay, so again as I said, I am not here to pinpoint कि उसका सही था, उसका गलत था, इसका सही था, उसका गलत था. That's why I deliberately removed all of the images which I got. So what will be the answer for stage 1 Ackermann? Sorry, I did not get you. Stage 1. Lawrence, what is your doubt? So group 1 is always appearance. So I think stage 4, all C1, C2 were concavity. That's what's the recall bias one can say. अगर आपने public health and उसमें PSM में पढ़ा होगा, there's a recall bias which is there. Okay, everyone has highlighted different kind of, some said they were accentuated concavity, some said they were flat, some said they were concavities or mild CT. ठीक है. So as I've said, told you before only, we are not here कि जो NBA के आंसर की को क्रिटिसाइज, जो उनके पास आंसर की होगी वो एक स्टैंडर्ड होगी, उसी को फॉलो किया जाएगा. What I am trying to here to say is prepare you for your next exam is कि CMI से अगर क्वेश्चन आया है तो नेक्स्ट एग्जाम में बी प्रिपेयर्ड. INI में का डायरेक्ट क्वेश्चन नहीं होता. INI में दे आस्क यू एन एप्लीकेशन क्वेश्चन बेस्ड ऑन द CMI स्टेज. अगर आपको पता है वेरी वेल CMI क्या होता है, वेरी वेल बहुत अच्छी बात है. नहीं पता, जस्ट गो बैक, रीड इट एंड उसका एप्लीकेशन क्या है फंक्शनल में अप्लायंसेस में, किस स्टेज पे हम अप्लायंस दे सकते हैं, किस स्टेज पे कौन सा अप्लायंस दे सकते हैं. ओके सर, आई एम आस्किंग यू आंसर ग्रुप 1 एंड इट्स प्रॉफिट इज प्रोफाइल यार, इट्स प्रोफाइल. Lawrence, it's profile. That's what I mentioned. I have mentioned, given you the reference as well, why it's profile and alignment क्यों नहीं है. Okay, I hope I'm clear. Prakash says, sir, I was expecting question on aligners and their materials which you have taught. कोई नहीं आए तो you got to know something. That's all I can say. Aligners are the latest or the newer things and be prepared. INI में definitely आ सकता है. Okay, consider it as an inside information kind of a thing because अभी recently मैंने workshop लिए, so आ सकता है. Moving ahead, I won't speak much on this now. Okay, stages of cervical. As I was saying, just be prepared कि next INI exam में you can get an explanation or you can say get an question based on the clinical scenario of CMI staging. Okay, so उसका एप्लीकेशन कहाँ होता है, कौन सी स्टेज में यू कैन फंक्शनल अप्लायंस थेरेपी एंड कौन सी स्टेज पे यू कैन हैव टू गो फॉर अ सर्जिकल ऑप्शन. जस्ट बी प्रिपेयर्ड विद दैट. सो जस्ट अ समरी ऑफ CS 1, 2, 3 and 4, जिसमें सबसे इंपॉर्टेंट यू नीड टू नो अबाउट CS 3, 4 and 5. Okay, so lower border and next is the shape of the C3 bodies of C3 and C4. So C3 and C4 are trapezoid or rectangular, horizontal in shape with peak in mandibular growth to occur within 1 year of this stage. C4 is C2, C3, 4 are concave with C3 and 4 are rectangular, horizontal in shape. Okay, with the peak occurred within 1 or 2 years before this stage. Okay, and last is CS5 and 6. अगर 5-6 में है तो patient is surgery only. 3-4 में you can go for functional appliance, mostly 3. 4 में है तो you can go for fixed functional appliance. Okay, after 4, that is 5-6, surgery is the only option. No myofunctional appliance correction can be done. Okay, moving ahead. Which is not a prerequisite for anterior inclined plane? Okay, so what do you mean by anterior inclined plane? They want to ask about Catalan's appliance. So what is Catalan's appliance? Which is basically given on the lower arch, cemented on the lower arch to correct the crossbite or you can say lingually inclined incisors. So they are asking not a prerequisite. Okay, so first, to correct an anterior crossbite, enough space in maxillary arch definitely is wanted. Okay, normal to severe anterior crossbite. Okay, severe is the word. We'll consider this option and move ahead. Eruption of permanent mandibular canines and proper mandibular teeth to support acrylic buildup is definitely required, because since this appliance is cemented on the lower arch. So I mark eruption mandibular canines. Okay, according to me that is the correct answer, that eruption of permanent mandibular canines is not a prerequisite. Okay, what we want is a erupted lower incisors or not mobile incisors. Okay, I'll get back to your question, Prakash. Okay, do close by. Okay, so the prerequisite for giving a Catalan's appliance are, first of all, Catalan's appliance is corrected for correction of upper anterior single tooth crossbite that is of recent origin. Means अगर हम इसको डेंटिशन की स्टेज में देखें, अर्ली मिक्स डेंटिशन. अर्ली मिक्स डेंटिशन है मतलब क्या हुआ, लोअर इंसाइजर्स आर द फर्स्ट टू इरप्ट, दे हैव इरप्टेड. कैनाइंस जो होते हैं वो लेट इरप्ट होते हैं, अप्रोक्सीमेटली 9, 10, 11, 12, some not at that age. Okay, so giving a Catalan's appliance it's not required or it's not necessary for a permanent mandible canines to be erupted, and hence it's not a prerequisite for anterior inclined plane. Now some students got confused with this term normal to severe anterior crossbite. I also got confused कि severe crossbite anterior crossbite को correct करना through Catalan's appliance is difficult. Okay, but अगर हम as I've already said and repeated it time पे हमने over the sessions में भी एक कहा है, हमेशा ruled out option दे चलो. When in confusion, दो options बचे, दो में से आप rule out करके, we have ruled out option A, we have ruled out option D. Now we got confused between B and C. C हमें definitely पता है कि since Catalan's appliance is given in early mixed dentition phase जब canine erupt नहीं हो रहा permanent, so it's definitely not a prerequisite for anterior inclined plane. Okay. Now coming to the severe anterior crossbite, there are certain case reports present in orthodontic literature जहाँ उन्हें severe anterior crossbite that is dental not skeletal भी correct किए through this appliance as well. Okay, skeletal hair crossbite means the maxilla is small, mandible is ahead like a skeletal class 3, then it cannot be corrected through Catalan's appliance. It's a skeletal problem, you need to give a face mask or plan accordingly for it. Okay, so there are certain cases. और severe में भी कितना, severity is a subject, it's a subjective term. For some 2 mm 3 mm is also severe, किसी के लिए severe 5 mm 6 mm. यहाँ पर measurement mm में कहीं नहीं दी गई कि इतना mm severe crossbite है. सो दिस सीवियर टर्म वाज जस्ट गिवन टू कंफ्यूज आपको एग्जाम में करने के लिए कि सीवियर लिखा है तो डेफिनेटली विल थिंक यार सीवियर है तो वी कैन नॉट बी करेक्ट. ठीक है. सो ऑलवेज व्हेन इन कंफ्यूजन यहाँ दो सिमिलर से ऑप्शन है, गो विद रूल आउट एंड स्टिक टू योर बेसिक्स कि क्या थ्योरी में हमने पढ़ा. ओके, आई होप आई वाज एबल टू आंसर यू विद इनफ explanation and reasoning. And now I'll get back to certain comments which I got here. As I was a liners, मैंने आंसर कर दिया. Mark permanent mandible canine, very good. Apart from tags, what other appliances can be used for maxillary expansion after suture closure? अगर suture close हो चुका है, okay, normal or excessive overbite is an option, sir, not anterior cross bite. Okay, normal or excessive, okay, I'll correct this. तो फिर तो और भी क्लियर हो गया. अगर एक्सेसिव ओवरबाइट है तो हमें कुछ नहीं करना, एक्रिलिक की थिकनेस बढ़ानी है. एक्सेसिव ओवरबाइट है मतलब डीप बाइट है, यू नीड टू इंक्रीज द जस्ट द एक्रिलिक थिकनेस. ओके, सो थैंक यू फॉर करेक्टिंग दिस क्वेश्चन. ओके, नाउ और भी क्लियर हो गया. ओके, अगर उसमें भी किसी को क्लियर हो, दैट्स वाई दिस कैटलाइंस अप्लायंस इज नॉट टू बी यूज्ड फॉर मोर देन 3 weeks. अगर इतना सीवियर एंड हाई कोल्ड क्योर के साथ हम देंगे तो इट कैन लीड टू एक्सट्रूजन ऑफ पोस्टीरियर ओपन बाइट एज वेल. ओके, सो eruption of permanent mandibular canal. So I just correct this. So normal to severe, normal or excessive overbite. Thank you for that. Now I have to answer question of Prakash. So apart from tags, so the basic thing is once the growth is completed, the suture is ossified. Now if you give a simple appliance like nitide spring or coffin spring or cord helix, only dental expansion will occur, that is the teeth will just tip, they won't get expand now. So what you have to do is open the suture. अब suture open करने के लिए there are various means. First is either you can surgically cut it. Okay, surgically leafwort 1 osteotomy karo and then the suture is open, you apply, give the expansion appliance and the transverse expansion will occur. Okay, first way is this. So surgically assisted rapid palatal expansion or SARPE or SARM. First way is this. Next is TAD assisted. Okay, TAD means temporary anchorage devices that are mini implant assisted expansion of the transverse suture, transverse dimension. So TADs क्या रोल प्ले करते हैं इसमें? अगर हम TADs इंसर्ट करेंगे, TADs एज अ स्केलेटल एंकरेज डिवाइस. ओके, उससे जो एक्सपेंशन होता है, इंस्टेड ऑफ रिलाइंग ऑन डेंटल एक्सपेंशन, द टैड्स आर इंसर्टेड इन द सुचरल एरिया एंड ब्रिंग अबाउट स्केलेटल एक्सपेंशन. सो दिस इज द सेकेंड वे. Okay, so there are two ways. First, you can either surgically give a expansion or surgical cut or incision to fracture the suture, that is SARPE or SARME, and then bring about expansion using any simple expansion appliance. Because once the suture is separated or fractured, you can simply put a rapid Hyrax screw as well to bring about the expansion. अगर सर्जिकल नहीं करना है तो then you have to go for mini implant or TAD assisted. Okay, अगर हम ऑर्थोडोंटिक्स में जाए तो there are various grades. ओके, हम टैड का प्लान करते हैं, कल हम सर्जरी के लिए जाते हैं. सूचर ऑसिफाई होने से पहले वी नीड टू टेक अ CBCT स्कैन, जो व्हाट वी डू एंड चेक कितना ऑसिफिकेशन हो चुका है. देयर इज अ स्केल, एंजिलरी स्केल, व्हिच इज नॉट टू बी डिस्कस्ड हियर एट अ ग्रेजुएट लेवल. वंस यू गो देयर, तो उसके स्केल के बेसिस पे वी प्लान इट. ओके, सो आई होप आई आंसर इट. ओके, इज इट एक्सेसिव ओवरबाइट इज प्री रिक्विजिट? The question was not a prerequisite, means not an criteria for giving Catalan appliance. अगर excessive overbite है तो we can give anterior inclined plane or Catalan appliance. We don't have to worry about it. But canine erupt हुए हैं, eruption of permanent mandible plan, it's not a criteria, it's not necessary. We have to check before planning a Catalan appliance. I hope the language of the question is clear to you. अगर overbite ज़्यादा भी है मतलब ओवर बाइट ज़्यादा क्या मतलब डीप बाइट. So what do you have to give? अब deep bite है means the overlap is too much. You need to open the bite and then bring about this. So उसके लिए करना क्या है? This acrylic जो है उसकी thickness आपको बढ़ानी है just. The height of this acrylic should be too much. Okay, so it's clear. Next, which of the following is used to determine the amount of incisor show in post smile or percentage of incisor visibility in relation to clinical crown height? Two kinds or two language of questions which I got. The option was smile arc, Morley's ratio, smile index, Bolton ratio. A very easy and direct question. Nothing much to discuss in this. Smile arc क्या होता है? Is the consonancy or the upper incisors जो follow करते हैं lower lip के according or not. Okay, eliminated. Bolton ratio. Sir, only one question gone wrong, that prerequisite वाला. ओके यार वो भी गलत नहीं करना चाहिए था, थोड़ा सा अगर कॉम डाउन होके करते तो हो जाता, पर एनी हाउ what is done is done. Okay, this better prepares you for your next INA exam. Okay, and again I'm saying don't get too overconfident कि हमारा जैसे अब recall sessions होंगे with all that other faculties as well कि that we got this much only correct and you stop studying for your INA exam. Okay, so please again I'm saying few 25-24 days study light and do study for that exam. Okay, so as I was saying, smile arc very easy. Bolton ratio, it's a part of model analysis. Okay, hence not related to visibility or smile as such. Morley's ratio or smile index. So smile index क्या होता है? Intercommissural width by the interlabial gap during smile. And Morley's ratio is the percentage of incisors shown post smile respect to the clinical crown height, and average value 75 to 100%. Okay, the correct answer is smile index. Okay, so जिसने भी ऑर्थोडोंटिक का इस बार पेपर बनाए हैं उसने ये this clearly indicates that they are more focused upon the profile and smile because these all characteristics are now part of the, you can say, newer kind of orthodontics which we do. Or orthodontics earlier you can say was most focused on just bring about correcting the alignment कि क्राउडिंग है उसको करेक्ट करो, ये करो, नॉट कंसर्न्ड अबाउट द स्माइल एंड सॉफ्ट टिश्यू प्रोफाइल ऑफ द पेशेंट. ओके, दिस 2-3 क्वेश्चंस क्लियरली इंडिकेट दैट द एग्जामिनर जिसने बनाया है वो पेपर नए क्राइटेरिया, नए कॉन्सेप्ट के अकॉर्डिंग बनाया. ऑल द मोर बिसाइड द फैक्ट दैट द एक्करमैन प्रॉफिट का आंसर प्रोफाइल ही. ठीक है, एनी हाउ अगेन नेक्स्ट क्वेश्चन इज मैरीलैंड ब्रिजेस आर नॉट इंडिकेटेड इन. Sort of a prosto question, but I took it in this orthodontic discussion only. Options are deep bite, bilateral cross bite, open bite, and cross bite. Okay, so Maryland bridges, as we all know from your prosto, they are minimally invasive bridge, which are wings, just minimal invasive से preparation करके they're given in the anterior region. Okay, अगर cross bite है, open bite है, या simple single tooth cross bite है, so why not Morley's ratio? So I said Morley's, sorry, answer is Morley's ratio only. Sorry, percentage of incisors show Morley's ratio only, my mistake. So Maryland bridges are not indicated in, so they are, as I was saying, what are Maryland bridges? They are minimally invasive bridges which are given on anterior teeth. So minimal tooth preparation is done in them. Okay, so cross bite, open bite और cross bite के cases में क्या होता है? Lower teeth are not touching the upper teeth. Okay, so you can very well given these kinds of bridges or. Okay, so the correct answer is not indicated deep bite cases. Why? Because the lower teeth are touching the upper teeth, leading to the failure of such kind of bridges. Okay, I hope I'm clear. A very simple and easy question. Next example of one couple system, cantilever spring, utility arch. If anyone can help me with the remaining 2 options as well. What are the remaining 2 options? So I'll be able to tell, or you can have a roll out kind of a thing if there was any confusion. example of one couple system पूछा था. Is the question correct? What I got was the question as example of one couple system is. Options were cantilever spring, utility arch. Other options are two couple system is given and I marked it. Was two couple system part of option? That option C was two couple system. If anyone can elaborate me the question or something like that, if I am wrong with the question, that will be of much help. Yes, I corrected it, 20.25, and Nikesh Maheshwari says yes. So anyhow, if anyone can recall this question correctly, example of one couple system is option cantilever spring, utility arch. Okay, this is the question which I got from the student. Okay, if anyone has the correct question, or you can say if I am not correct, you can very well help me and point it out here itself. So what is a one couple and two couple system? Two couple system is option. Okay, seems like the examiner ran out of giving you an option in this question. Then if they're directly giving you an exam, asking you about example of one couple system and giving you an option as two couple system. This question is right-handed, but from these two options not able to recall other two. So some okay, Prakash taken into account, and Nikesh is saying two couple system is the option. Okay, so we are just remaining with the fourth option. If anyone has the fourth option, just point it out and I can help you. Anyhow, so example of one couple system. So if they are giving you two couple system in the option and asking you about one couple, that directly eliminates this option. No sir, two couple system wasn't in the option. Okay, anyhow, if anyone remembers other two option, I also doubt whether they will give you two couple system in the option and ask you about that. Okay, that remains is with two options, that is cantilever spring and utility arch. So as I've told you repeatedly, okay, no need to pinpoint anything, accusations or like that. Okay, no problem with that. If you marked it, just remember, and if was any their thought process or any reason which you marked it, or you want to clear your doubt, you can very well ask your parents and I'll be able to help you out with that. Okay, so what are one couple system and two couple system? We have discussed it repeatedly in our class lectures, predictive series, revision series, everywhere. Okay, so what is a one couple? When there is a two attachment, when a couple is created one end and a single force is created at another end. Okay, also known as a one bracket source system. Examples are cantilever spring or auxiliary arch placed into a bracket or two. And common terms which I just repeatedly mentioned it during a course of lecture is placed, loosely ligated, just touching. These are the common terms which are used to describe or point you towards one couple force system. Okay, and next two couple force system when the wires is inserted into two slots, simple as that. Okay, and next what are step bends? Created two couples in the same direction regardless of a location between brackets. INI में ये V bend का कॉन्सेप्ट जरूर समझ के जाना. अगर किसी को डाउट है, just ask me in the group of club and सिमेट्रिक और एसिमेट्रिक V bend, किस पे कौन सा मूवमेंट ज़्यादा होता है, इस पे कपल ज़्यादा होता है, जस्ट प्लीज इसको बिल्कुल क्लियर करके जाना. ओके, anyhow, I hope I am clear. So the correct answer is direct based question, it's cantilever spring. Okay, as I have told, there is no need to pinpoint accusations and anyone here. We are just here to discuss the question and clear the concepts. Okay, so I respect everyone not to pinpoint these things like that on the channel. Okay, next question: improved or newer version of beta titanium or TMA wire. So beta titanium or TMA stands for titanium molybdenum arch wire. Okay, again as I said, I got 5 options in this question. Come beginning with the last, copper nitai, इसके नाम में nitai है तो it's not part of a TMA wire. Okay, optiflex wire, it's a nylon coating or you can say aesthetic wire. बेसिकली नाइटाई वायर पे एक नाइलॉन और वाइट कोटिंग चढ़ाई गई जाती है जो टू मेक इट मोर एस्थेटिक. नेक्स्ट, डुअल फ्लेक्स वायर. डुअल फ्लेक्स मीन्स दे आर 2 wires, so it has properties of nitai plus SS both. Super cable wire, it's a newer or modified version of SS that lives with CNA. CNA stands for Connecticut New Arch Wire. It was discovered or you can say invented or made by Dr. Ravindrananda from University of Connecticut. Okay, it imbibes the property of TMA in it. ओके, सो TMA की क्या क्या मैकेनिकल प्रॉपर्टीज़ है वो आपको पता होनी चाहिए कि क्या इसका मैकेनिकल फ्लेक्सुरल स्ट्रेंथ क्या क्या है, सब यू शुड बी अवेयर फॉर योर नेक्स्ट एग्जाम. ओके, बहुत कॉमन क्वेश्चन है डिसेंडिंग असेंडिंग ऑर्डर में अरेंज करना फॉर योर INI एग्जाम. ओके, सो जस्ट बी केयरफुल. अगेन आई एम सेइंग, आर्च वायर से क्वेश्चन पूछा गया है. CNA इज नॉट गिवन, कैन इज गिवन. नहीं, कैन तो नहीं दे सकते, कैन तो कुछ होता ही नहीं है, कोई काइंड ऑफ वायर ही नहीं है कैन. कैन टाइप की कोई आर्च वायर है ही नहीं या कोई मटेरियल है नहीं वायर का. ओके, so just एक बार if anyone has any other apart from Florence, if anyone has any other option, or you can say if others also saying can ही था, नहीं someone saying CNA is given, so can करके Florence there is no arch wire or material as such. Okay, so as I was saying, for what I wanted to highlight is INI में they can give you in arrange in ascending or descending order उनकी मैकेनिकल प्रॉपर्टीज के बेसिस पे. ओके, जस्ट गो थ्रू देम एंड अगर याद है बहुत अच्छी बात है, नहीं याद है जस्ट रिवाइज देम. ओके, सो दिस इज जस्ट आई ओपनर यू कैन पिन पॉइंट टुवर्ड्स योर नेक्स्ट एग्जाम. नेक्स्ट, अकॉर्डिंग टू हार्वर्ड एनालिसिस, length of the mandible can be measured in a cephalogram which of the following parameters. So Harvard, or you can say Harvard McNamara analysis. Okay, so as I discussed in the class, it's an analysis used for before doing functional appliance therapy. Okay, so it's a part of functional appliance therapy. So what are they asking you about? How to measure, what are the landmarks used to measure the length of the mandible? Condylion to pogonion, gonion to nathion, pogonion to gonion, gonion to menton. Okay, अगर मैं इस क्वेश्चन को डिफरेंट वे से अब अप्रोच करूँगा, जस्ट आप लोगों को कुछ समझाने के लिए. अगर if you guys were able to answer it very well, those who were not able to answer it, it's for them how to approach a question. अगर एक ऐसा क्वेश्चन आ जाए जो कभी देखा नहीं है, सुना है. So this is the image of a mandible. Okay, condylion point यहाँ होता है. Okay, gonion point यहाँ होता है. Okay, menton सबसे नीचे, nathion ऊपर, pogonion सबसे आगे. Okay, so सिंपल सा लॉजिक है. अगर हम इन 3 ऑप्शंस पे जाएं, गोनियन टू नैथियन, गोनियन टू मेंटन या पोगोनियन टू गोन, तीनों पॉइंट्स जो है और तीनों जो लाइंस है वो हाईलाइट कर रही है टुवर्ड्स बॉडी ऑफ द मैंडिबल या सेम रीजन के बीच में. अगर किसी को, तो मेरा कहने का मतलब ये है कि अगर इफ़ यू हैव सम बेसिक नॉलेज, ये पॉइंट्स कहाँ लोकेटेड है, यू डोंट नो अबाउट दिस हार्वर्ड एनालिसिस, वॉट एवर दिस इज, you would have been very well able to answer this correctly or very easily, that it's condylium to pogonium, which is used to determine the length of the mandible. Okay, so this was just a small brief, highlight कि कभी कभार you might get certain questions in your exam जो आपको बिल्कुल पता ही नहीं होंगे, you haven't seen कि भाई ये क्या है, हार्वर्ड एनालिसिस, व्हाट, ये कहाँ से आ गया एकदम हार्वर्ड एनालिसिस, ये ऑर्थो का ये कि किसका, ये भी नहीं पता उस टाइम पे. अगर जस्ट फॉर द 5-6 सेकेंड ठंडा दिमाग करके क्वेश्चन पढ़ा, जस्ट विजुलाइज किया डायग्राम, यू वुड हैव बीन एबल टू मार्क दिस करेक्टली वेरी इजी. And this is what a PG entrance exam tests you, whether you are prepared to do post graduation or not. Anyhow, coming back to this question. Okay, so condylium to pogonium. So this analysis, as I have told you, is done before giving or starting any functional appliance therapy. By functional appliance therapy का एम क्या है कि मैंडिबुलर लेंथ अगर शॉर्ट है या मैंडिबल छोटा है साइज में, उसको आगे लाना या उसको लेंथ करेक्ट करना. तो इफ द लेंथ इज शॉर्ट, इट कैन बी, और दिस कोमोडियल पोगोनियल लेंथ इज शॉर्ट, यू कैन गो फॉर फंक्शनल अप्लायंस थेरेपी. एंड एट द सेम टाइम, अगर इफ यू रिमेंबर चॉर्क एनालिसिस, द मैंडिबल इज रेट्रो पोजिशन और बैकवर्डली पोजिशन इन द कॉन्डाइल ऑफ ग्लिनॉइड फोसा. अब हम ग्लिनॉइड फोसा को उठा के स्केलेटल में आगे नहीं ला सकते ना, तो एट दैट पॉइंट या उस केसेस में फंक्शनल अप्लायंस थेरेपी कैन नॉट बी और इट्स नॉट बी फ्रूटफुल, बिकॉज कॉन्डाइल की या पोजीशन ही पोस्टीरियर है इन द ग्लिनॉइड फोसा. सो दिस इज द एप्लीकेशन ऑफ दिस डिटरमाइनिंग द लेंथ. सो व्हाट द एम ऑफ दिस एनालिसिस, ये मैं थोड़ा सा आपको एक्स्ट्रा बता रहा हूँ जस्ट फॉर योर आईएनए एग्जाम. वहाँ पर आपको कोई वैल्यू भेजा नहीं पूछेगा, जस्ट अगर मैंडिबल की पोजीशन ही पीछे है इन द ग्लिनॉइड फोसा, हाउ इट्स डिटरमाइंड यूजिंग चॉर्क एनालिसिस व्हिच वी हैव डिस्कस्ड, जिस पे आपको क्वेश्चन भी आए हैं पहले आईएनए में. सैडल एंगल एंड ऑल दैट, आर्टिकुलर एंगल. सैडल एंगल अगर ज़्यादा है, इसका मतलब सैडल एंगल इज फ्रॉम नेजियन सेलर टू आर्टिकुलर, इट्स मोर मीन्स आर्टिकुलर पॉइंट पीछे है, कॉन्डाइल ही पीछे पोजिशन है. यू कैन नॉट ट्रांसलेट द मैंडिबल इनसाइड द, यू ब्रिंग द ग्लिनॉइड फोसा फॉरवर्ड, वो जहाँ बना है वो वहीं रहेगा. ऑल यू कैन डू इज इंक्रीज द लेंथ ऑफ द मैंडिबल. हाउ इज द लेंथ ऑफ द मैंडिबल इज इंक्रीज? बाय डिपोजिशन ऑफ बोन हेयर. फॉर रिमेंबर थ्योरीज ऑफ ग्रोथ, लाइट बल्ब एनालॉगी, सर्वो सिस्टम थ्योरी, उसके थ्रू. सो अगर यहाँ पर बोन डिपॉजिट होगी तो कॉन्डाइलियन का पॉइंट पीछे जाएगा, ये लेंथ मैंडिबल की बढ़ जाएगी. सिंपल सा लॉजिक. ओके, नेक्स्ट, इन OSA ट्रीटमेंट CPAP. Okay, again I don't have the fourth option of this question. Works with oral appliance only, not effective in moderate to severe cases, delivers air pressure through mask. Okay, a very easy question. CPAP stands for, as I've already told you, ये OSA for topic cleft lip and palate and orthodontic surgery. Okay, ये तीन topics are the most ignored topic in orthodontics because ये एंड में आते हैं बिल्कुल, एंड इनकी रेलेवेंस पहले के टाइम पे इतनी नहीं थी. पहले का टाइम इज द टाइम लाइक विच द टाइम आई गिव लाइक 2018 2019, बट इन रिसेंट ईयर्स पोस्ट कोविड ये थ्री टॉपिक्स आई हैव रिपीटेड टोल्ड यू, हर बार एग्जाम में क्वेश्चन है. बीट INI 2 times INI, बीट क्लेफ्ट लिप एंड पैलेट डेफिनेटली आएगा. OSA OGS पे दे सर्कुलेट, और समटाइम्स दोनों पे भी दे देते हैं. एंड दे आर द मोस्ट इग्नोर्ड टॉपिक आई कैन से इन योर. जब भी हम रिवाइज करते हैं, हम थ्योरीज ग्रोथ से पढ़ेंगे, अप्लायंसेस पढ़ लेंगे, यहाँ करते वी गेट टायर्ड एंड वी लीव देम और इग्नोर देम. Sir, one option was can't be used in severe OSA. तो एक ऑप्शन है वैसे इधर, नॉट इफेक्टिव इन मॉडरेट टू सीवियर केसेस. Anyhow, I just pinpoint this option as well. Anyhow, the answer is works with oral appliance only, not effective in moderate to severe, delivers air pressure through mask, can't be used in severe cases. So which is the true statement they are asking. So works with oral appliance therapy? No, oral appliances are not necessary for giving CPAP. CPAP is a continuous air positive airway pressure through a mask. So it's like a mask through which is administered and high pressure air is given. It was, this appliance was very popular during the COVID time. Okay, जिसकी shortage हो गई थी and these appliances were bought from other countries. इसकी shipment 2020 2021 a time of December November. Okay, so not effective in moderate to severe cases. It is effective in moderate to severe. Mild cases means it is of no use. Delivers air pressure through mask, that's the correct, and can't be used. It can be used in severe cases. Okay, so इससे related OSA related for your exam AHI index, appliance oral appliances की images for correcting OSA. जरूर just look at them for your exam, IN exam. Okay, so this is what is CPAP is. This is the image of CPAP. Baki images we have discussed in your class, you can go through them. Okay, another very easy question, most ideal time of cleft palate repair. Okay, we have a timing repair का एक flow chart है पूरा. We have discussed this in class n number of times. Okay, can you please clear about Morley's ratio question please? The answer is Morley's ratio only, it's not smile index. My mistake was there. मैंने नीचे Morley's index बताया पर टिक गलत आप कर दिया. Morley's ratio is the answer. Percentage of incisor shown. And smile index is just dividing the intercommissural width by the buccal point lobe. I'll come back to that question. Let's complete this last question. And this is a, you can say, a repeated question from your past exam. Cleft lip and palate is due to non-uninom. ये last आपके INI में भी आया था अभी और NEET 2024 में भी आया था. Options अलग थे. Okay, so cleft lip and palate is due to the non-fusion of median nasal process and the maxillary prominence. Okay, इसमें टाइमिंग ऑफ रिपेयर इंपॉर्टेंट है. फ्यूजन डिफेक्ट किस एज पे होता है, किस वीक ऑफ डेवलपमेंट, एंड मोस्ट इम्पॉर्टेंट यू नीड टू नो अबाउट टेराटोजेंस. किस टेराटोजन को किस टाइम पे दिया तो क्या प्रॉब्लम हो सकती है. दिस इज नॉट ओनली इम्पॉर्टेंट फॉर योर OS, सॉरी नॉट फॉर ऑर्थो बट ओरल पैथ एज वेल. ओके, एंड लास्टली रिपेयर प्रोटोकॉल, किस एज पे क्या रिपेयर करते हैं एंड कब करते हैं. PNAM अप्लायंस लास्ट टाइम आपको आया था INI में. PNAM का क्या यूज़ है, क्यों करते हैं. ओके, सो जस्ट इन ब्रीफ I have discussed the questions which came in your this NEET exam, and again I am telling you my aim was not to pinpoint the correct answer or you do this do that, किसके कितने सही है कितने गलत है. That is in the hands of NBE, for which you have paid the hefty fee for taking your exam. Or let them do their job and give you their ranks. Okay, so wishing you all the best for that. Okay, whatsoever it comes, my only message is, so you already told us अब की cleft lip and palate timing and non-fusion भी आएगा. Okay, anyhow we shouldn't इस वजह से होता क्या है, it becomes highlighted कि we get some kind of paper leakage or something like that. Okay, so as I was telling you, whatsoever rank you get, okay, उसको डब्बे में डाल के साइड में focus on, if it's good rank definitely go, you get all your dream colleges in branch जिसमें चाहिए. Not focus on your axis, but according to me PG करना must है for a proper BDS graduate के लिए in this scenario. Okay, so focus, again I'm saying focus on your next INA exam. Practice last 10 years के INI, मतलब 20 पेपर्स डायरेक्टली हो गए. एक साल में 2 लेते हैं डेंटल के, मेडिकल के नहीं, डेंटल के जो INI पेपर्स हैं 20 पेपर, एंड स्टार्ट फ्रॉम द लेटेस्ट वन, मतलब 2024 नवंबर से, एंड देन गो बैक. ओके, आफ्टर यू आर डन विद दिस 20, देन फोकस ऑन द SR पेपर्स ऑफ INI. वो भी लेटेस्ट से स्टार्ट करके पीछे तक, पीछे से आगे नहीं आना. ओके, सो आई होप आई एम क्लियर. I have provided you with a roadmap for your exam as well. किस टॉपिक से क्या they can ask you in the INI. I hope I have done we hopefully will meet once again for your exam with certain predictor series or whatever. We'll discuss and let you know guys know. किसी को किसी type की help चाहिए, you know where you can reach me. Just keep on solving questions and previous year questions. Okay, and that's all from my side. Okay, so I'll just